If you want to talk about saving money in healthcare, you need to talk about Medicare. And Medicare is the government program that we use to help us pay healthcare costs for people over 65 and the permanently disabled. That's about 44 million people. In 2009, that program is expected to cost about $420 billion. That's 14% of the US budget. And Medicare is a fee-for-service program, so a doctor or hospital or medical provider provides a service and the government reimburses that person. In an effort to control costs for the physician services part of Medicare, Congress instituted something called the Sustainable Growth Rate Formula. And in any given year, if expenditures exceed the target, what happens is payments are reduced. And then what happens is that doctors start going for the exits. To keep that from happening, Congress overrides the target expenditure so everybody gets their money. And that's been happening every year since 2002. The Medicare Payment Advisory Commission, yes, we have a commission on that, is struggling with this issue and is trying to come up with a recommendation to Congress, only they're split as well. There are some who think that SGR is a crock and you can't have any kind of expenditure target, and then there are those who think that, yeah, it may not work perfectly, but it's the only thing we have to rein in costs. But whatever side you take, I'm struck by this Soviet-style, top-down, central planning approach to healthcare. It's all about expenditure targets, price formulas, price outputs, and allocation of costs. But what really floors me, in addition, of course, to the ever-increasing costs and the apparent fact that none of these people have heard of Friedrich Hayek, is that no matter what report you read, whether it's from Congress or the Congressional Budget Office or MedPAC, everyone agrees that Medicare lacks an incentive for quality. Doctors don't get rewarded for primary care or preventive care. Doctors don't get rewarded if they coordinate care with other medical providers for a particular patient. So what you have is that some patients get lots of medical care but not really good outcomes, and then some patients don't get enough medical attention and they end up with a very expensive hospital stay. What's going on here? Now, in all the different topics I've covered, I can't say how much money tinkering with Medicare will save us. And of course, we'll hear about it if we screw it up. But wouldn't it be nice if the doctor-patient relationship meant something more than what a particular commission came up with? I mean, just as an example, maybe we could give each Medicare enrollee a certain number of healthcare dollars that they could spend as they see fit. Maybe even allow that amount to roll over if all the money wasn't used in a particular year. I mean, something's got to be better and cheaper than what we've got now.